If you care about your health, you need to hear this, because there are certain things that you're doing on a day-to-day basis that can have a major impact on your kidneys and cause damage to your kidneys. So in today's video, I'm going to go through 7 of the most common things that can cause kidney damage. Trust me, I think you really want to hear about this. So starting off, we can think about our non-steroidal anti-inflammatory drugs. These are a group of medications such as ibuprofen and naproxen, commonly used to treat arthritis. Now, an overuse of these type of medications can impair kidney function in the long term because it can cause a reduction of blood flow to the kidneys. So we know that reduced blood flow to the kidneys can cause damage, and prolonged use over a prolonged period of time can also lead to chronic kidney disease. So our advice to patients is to use these type of medications, our non-steroidal anti-inflammatory drugs, in moderation, and also to consider other type of medications such as paracetamol for pain relief. And remember, if there's chronic pain involved, it's really important to see your healthcare professional to really guide you and assist you with these symptoms. Secondly, not hydrating yourself well enough can cause kidney damage. This is because inadequate hydration reduces how much blood flows through to the kidneys. And as we talked about before, reduced blood flow to kidneys can over time cause damage to the kidneys. This can also impair the kidneys' ability to filter out all the toxins. And as we know, chronic dehydration over a period of time can lead to other kidney conditions such as kidney stones. So with this, we advise patients to ensure that you're having an adequate fluid intake each day. This is typically around 8 glasses of water daily. And obviously you can alter how much you're drinking depending on the day itself, how hot it is, and according to each individual's requirements. Next up on our list is a diet that's really heavy in excessive amounts of salt and sodium. Now this can cause kidney damage because excessive sodium and salt in the diet can lead to high blood pressure. And as we know, when blood pressure is too high, that can really impair the way in which the kidney functions. Also, our kidneys play a crucial role in regulating sodium levels. So an excessive amount of sodium in the diet can also impair the kidney's function in doing so, leading to kidney damage. So the main advice with this is really keep an eye on your salt intake and your sodium intake and really limit this and reduce it. So when it comes to foods, you can flavor them with spices and herbs. And also be mindful of our processed foods because these can be quite high in sodium content. Another thing that can have an impact and affect your kidneys and cause damage in the long term is really not going to the toilet for a wee when you have to. This is basically holding in your urine. Holding in urine regularly can cause that urine to build up. Bacteria can grow within this urine, leading to urinary tract infections. In the long term, this can have an impact on the kidney's function. So basically, we just advise patients to be using the toilets regularly for a wee and having a really good schedule, not holding in that urine. Another thing to be aware of that can cause kidney damage over the long term is excessive alcohol intake. Now this occurs because excessive alcohol can impair the kidney's function in maintaining fluid balance, and it can also impair the kidney's ability to filter out all the toxins. So the main advice is really being mindful of your alcohol intake and keeping this within the reasonable guidance level. So in the UK, we advise both men and women to have no more than 14 units of alcohol per week. And I always say this on the channel, if you're struggling with things like your alcohol intake, there's lots of support out there to help you through with this. Another thing to be aware of that can have an impact on your kidneys and cause kidney damage is smoking. Now, we've got a video about smoking. I recommend you watch this. Smoking can damage the blood vessels that supply blood, nutrients and oxygen to the kidneys, and with this damage, there's less blood flow to the kidneys, which can also obviously lead to kidney damage. On top of this, there are so many different types of toxins in the cigarette smoke itself, and this can also lead to an impairment and reduction in kidney function, leading to a long-term damage to the kidneys. So, like before, it's important that with smoking, like a lot of things, to access the help that's already available to really help you to reduce how much you're smoking and to eventually quit. Last on our list of things that can lead to damage to your kidneys is the use of processed foods. Now, processed foods are particularly bad because they're quite high in sodium and also in other additives. And this can also lead to high blood pressure, which over time would damage the kidneys. This is why it's really important to be aware of these foods and think about your diet mostly consistent of whole foods and healthier foods. These are all ways in which you can avoid long-term damage to the kidneys. So just to summarize, adopting a healthier lifestyle is really important in keeping our kidneys as healthy as we can keep them. So we talked about things like your diet and also making other changes like reducing how much alcohol you're having, stopping smoking, and also being aware of the medications that you're taking. With all of these things, it's really important to access the help available to you through your healthcare professionals, through your GPs, and through other means as well. I'll attach loads of useful links onto the description to help you along this journey. As always, if you found today helpful and the video today helpful, please leave a like and subscribe. Make sure to check out some of the other videos that cover other bits and other topics that we've talked about today. And until the next time, I'll see you soon.